Good morning. I'm going to talk primarily this morning about reopening schools. A few weeks ago, the County Department of Health developed general guidelines for school reopening, which have been published at stlcorona.com. And these guidelines were developed with school administrators, with national and regional public health experts, with the pandemic task force, with teachers, and with parents. The guidelines suggest ways to get kids back into school safely, but always with the main goal of making sure that they can continue to learn so they don't fall behind. But we also understand that sometimes the safest way to continue to learn isn't in a classroom. So today, many school districts are expected to make their reopening plans public. Most of these plans that I'm aware of offer parents the choice of a learning environment in a classroom or a learning environment with technology, with a virtual classroom at home. Parents will be asked to make this choice over the next few weeks, and the choice won't be easy. I encourage them to talk to school administrators, to teachers, and to their doctors. I do believe that school buildings will be as safe for teachers, parents, and students as the districts can make them. But my own recommendation is to choose a virtual learning option when that's available. It's a recommendation that many teachers and parents have support and who I've heard from the most. It's a recommendation that St. Louis County will support with its resources as well. We are seeing a record number of new cases in our country and in Missouri. In our region, we're seeing new cases, especially in young people. And we know that new cases in young people is particularly alarming because they are frequently asymptomatic. And they put others at risk, other children, their parents, their grandparents, and teachers. We know this is concerning because they may not know that they're infected or that they're infectious. Both in-person and virtual learning tracks present challenges to schools, to teachers, to parents, and especially to students. I've spoken to Governor Parson, who shares concerns about keeping kids safe in school, but his hope is to have kids back in a classroom setting. I've asked him to make sure that schools who are heavily virtual in their education or primarily virtual in their education are not penalized with state funding or with any of their state resources. Later this week, St. Louis County will announce CARES Act funding that will be made available for technology to support the challenges of virtual education in a classroom at home, and to also recognize that, like all CARES Act funding, this resource will be directed to the places and to the people who need it the most. And of course, St. Louis County will be doing as much as possible between now and the start of school to bend the curve of new COVID-19 infections in our community. Masks remain mandatory in St. Louis County. Please wear them. Please abide by social distancing guidelines, and we all recognize that staying 6 feet apart from others is the best way to limit the spread of COVID-19 in our community. The Department of Health staff will continue to investigate complaints of bars, restaurants, gatherings, or other locations in the community that do not adhere to masking guidelines, to social distancing guidelines, or room occupancy limits and capacities. Over the weekend, St. Louis City announced that they would continue to limit their occupancy capacity to 75%. St. Louis County will continue with its 50% limit on occupancy based on building code guidelines. We have no intentions of expanding that anytime soon. The county's 300 contact tracers will continue to investigate any activities or locations where COVID-19 is spreading in the community. Based on their data, the Department of Health, along with the St. Louis Sports Medicine COVID-19 Task Force, which consists of 14 pediatricians representing all three health systems, have all come together with new youth sports guidelines. Those guidelines allow practices for kids in youth sports of 10 or less, but prohibit other activities associated with practices like social events, team meetings, or events that draw crowds. They also prohibit events that bring in other teams from other parts of the state to compete here in our region. These restrictions should help lessen the spread of COVID-19 among young people, and also should give us the best chance of an in-classroom option this fall. And these restrictions will stay in place until it's safe to roll them back. We're in the process of distributing $9.6 million to 60 agencies in the community for humanitarian relief. That includes providing rent and utility assistance, but also technology assistance for access to health care, but also access to technology that could help with virtual learning in a classroom setting at home. We are looking at providing more funds for food assistance as well. Last month, we awarded $2.6 million to groups in our community, to nonprofits who are currently distributing food to needy families. So here's my message for the week. With more people out and about, so is the virus. We are in unprecedented times. We know that the virus is still very present in our community. So let's continue pulling together, working together to do everything we can to get everyone back to work and back to school safely. And I'd be glad to answer any questions.
Dr. Bay, just to clarify, are you advocating virtual learning full-time or some kind of combination? Because so many districts are offering a combination of in-person and virtual. Or are you recommending that parents keep their kids home altogether?
I'm recommending that parents choose a virtual learning option when it's available, and we will continue to watch the development of COVID-19 in our community and continue to work with the superintendents with their current plans that they're rolling out today and tomorrow, and make sure that those plans will work for the information we have today, but also for the environment that we may be in when school starts again in the fall.
In your mind, is this just a safety issue? You don't feel that schools can be safe enough for kids?
Well, I believe that schools are going to do everything they can to make their schools safe. That depends on the way they adapt to social distancing, and we've developed guidelines that we believe are reasonable and with what we know currently about the spread of COVID-19 in our community. But we know that COVID-19 may continue to increase if we don't have more widespread mask wearing, if we are not able to bend the curve of the spread of COVID-19 in the community, then it will be much more difficult to have an in-school, in-class option this fall. Many schools are moving to at least partly virtual. Some, almost all, are offering a virtual option, and I'm encouraging parents to choose the virtual option whenever it's available.
That puts you in contradiction to the governor who wants kids back in school. What would be your message to moms and dads when they hear these two different messages out there?
You know, elected officials don't always agree with each other, but we have to continue to work together. We have to make our communities work, and we have to make government work. But my message, based on the information we have currently in St. Louis County, is that we have worked together with superintendents to create as safe as an environment in a classroom as possible, and each school district will be releasing guidelines that are specific to that school district, and we'll be learning more about those guidelines this week. I would encourage everyone to review those guidelines, parents and teachers who are working with the school superintendents to review those guidelines, and then make a decision that is best for them. My recommendation would be to choose the virtual option whenever it's available. And we have to recognize that all of these guidelines are subject to change, and all of them will be communicated
that if you have the choice between virtual and in-person, and a lot of the wealthier white parents choose virtual, but a lot of the minority parents that cannot, they have to go to work, choose in-person, it creates an inequitable situation where the kids of poor minority parents, or the kids of poor minority parents are going to be more at risk than the wealthier white parents. I would like you to address that, since
well, the whole COVID-19 response and the existence of this pandemic has many components of inequity, many, and that's just one of them. And it's serious, and it's a challenge that we have to recognize and we have to work through. And that's why St. Louis County is focused on directing its resources to the places and the people who need it the most. And that means technology support, that means humanitarian relief, that's rental assistance, that is everything that we can do, that we can identify through our partners in the community, ways to help. But there are many, many inequities that have been exposed by this COVID-19 pandemic.
Would one of the ways you would want to direct money, like one idea that's been floated is having like a gym open that has virtual school, for especially for kids and parents that have to work somewhere else. Is that something that the county could support? Has any school district talked to you about that option?
The school districts will have to determine the ways in which kids will be educated in a way that works based on the resources that they have. We'll work with them, the county will work with them on the public health guidelines and parameters to keep the kids safe. And we will work with them with resources that we have through federal funds to help address the inequities that surround education. But we would not be involved in telling them how to educate the kids. That would be beyond the scope of county government and our jurisdiction. But we will partner with them on how to keep the kids safe.
I'm getting texts as we're going here, so I just want to clarify. People are asking regarding the virtual going to school, there's these different levels of virtual, half and half, all virtual or all school. That's generally speaking what districts might come out with. You're saying your recommendation would be to keep kids home in virtual learning at all times whenever possible. Is that what I hear you saying?
I would recommend choosing the virtual option when it's available, to the extent that it's available. But I would also recommend parents listen to the presentations of the school administrators and listen to the details that are specific to their district, talk to the teachers, talk to the doctors about any specific concerns they have for their individual children before they make a decision. But at this point in time, I really do think that a virtual option is a good choice.
For those parents that do exactly what you say to do and can't do the virtual, don't like the answers they're getting from their administrators, what do they do?
Well, that is just addresses a lot of the complexities around COVID-19. There are a lot of things that are imperfect, and we have to work with the information we have to make the best decision we can to find a path forward. The most important thing is going to be to keep the kids safe and healthy. And if the parents don't have confidence that the options that are available for their kids, based on discussions with the administrators, with teachers, and with the doctors, if they don't have confidence that the in-classroom setting is safe, then they should choose the virtual option.
Getting back to the sports issue, we're getting some reports of different organizations pushing back, claiming that they have different data than you have. Is your decision on going where you're going with the sports on data from your team collecting information, and what are those numbers? We have specific numbers?
Yeah, so I'm not going to get into the details of arguing data points, specific cases, and percentages. I'm always going to turn to the experts in public health and the doctors in the medical community to provide an interpretation of the data they have and give me recommendations. I'm not going to debate the individual data points, but I'm going to turn to the experts. And the experts that we have turned to are the 14 pediatricians on the St. Louis Sports Medicine COVID-19 Task Force who represent the 3 health systems, along with our public health experts. And together, they have endorsed these new sports guidelines to allow kids to practice in groups of 10 or less, but to avoid the activities, socializing, team meetings, team events, and crowds, and to avoid allowing teams from other parts of the state to travel here to compete. And we have to do everything we can to limit the transmission of COVID-19 among young people to give them the best chance at a safe school and perhaps even safe sports at school this fall.
And your recommendation for virtual is safety-based, I'm assuming?
Absolutely.
Another issue, Councilmember Fitch and others have put out information this morning about this motion tomorrow night, these bills, that would give the county council some oversight over public health orders and emergency health orders more than 15 days in on a pandemic. You spoke about this generally early on when the CARES Act funding first came in. Could you expand upon your response to that action?
I think that this is just more of a partisan effort to try and limit public health orders, to limit stay-at-home orders, to limit any sort of health orders that keep our community safe. And it's unfortunate in the middle of a pandemic that we still see so much partisanship around the fundamentals of keeping people safe. And part of our path forward is to stop making mask wearing, public health orders, and all these things a partisan exercise. We need to follow the recommendations of our public health officials and our public health experts at the national level and here regionally, and those recommendations regionally would be specific to our local situation. We're in a better place than a lot of places in the country because of the decisions we've made, and we need to stay on that track. We really don't need to have a lot of partisan bickering about social distancing, mask wearing, and public health guidelines. Any other questions? Okay, thank you.
Thanks, Doug.